Good morning, Chesterfield County. Thank you for joining us for the fourth in our 9-part series of community meetings dealing with the reopening of school in the fall of 2020. We're excited to have you with us this morning and appreciate you taking time out of your busy schedules to learn more about the options that we are considering and how they will impact students, staff, and family members. We certainly look forward to working with everyone in this process and welcoming our students to school as quickly as we can and as safely as we can. We have with us our Dale District representative, the school board chair, Debbie Bailey. Technically a Dale District magisterial meeting, but we welcome anybody from across Chesterfield County who is interested in listening in. As you've seen, we have scheduled as many town halls as we can at different times throughout the day in order to accommodate family schedules. So we appreciate you joining us here today. Throughout the morning, you'll be hearing a presentation from our superintendent, Dr. Merv Doherty, followed and some welcoming remarks from Mrs. Bailey. You'll hear from our Chief of Schools, Dr. Lisa High, our Chief Academic Officer, Dr. Sharon Pope, our Chief Operations Officer, Mr. Josh Davis, and our Deputy Superintendent, Thomas Taylor, who will all be combining forces to answer the questions that have been submitted so far. We appreciate everybody's engagement in this process to this point and anticipate that you all will remain engaged over the next 3 months as we head into September and start to welcome students back for instruction. Today's agenda will be some opening remarks from our school board chair, Mrs. Bailey, Dr. Doherty giving the presentation, a modified presentation that was provided to the school board last week. I say modified because we have added an extra option in there, a modified version of an option. And then after Dr. Doherty gives that presentation, Ms. Bailey will entertain some thoughts on where we are, and we will jump right into the questions that have been submitted in the past 36 hours, 48 hours, whatever it may be at this point. We've received more than 800 different questions from residents. We had anywhere from 8,000 to 17,000 viewers on our various platforms yesterday with the town halls, and they were very engaged and left lots of questions. We mentioned yesterday that we will be putting the most frequently asked questions into a document to put on our website so that parents, residents, and staff members can stay engaged through this process as well. Again, this is town hall number 4. We have 3 today and 3 more tomorrow. So please share this information with your friends and family members and colleagues so that everybody can be informed and understand what we're looking at, why we're looking at it, and what's going to play a role in reopening schools in 2020. And with that, I will turn it over to our school board chair, the Dale District representative on the school board, Debbie Bailey.
Good morning, and thank you, Tim, for that introduction. Thanks to everyone for joining us for this very important conversation. As Tim has mentioned, I'm Debbie Bailey. I'm the Dale District School Board representative and chair for the school board. Let me welcome you to the second of 3 virtual town hall meetings that I will host. The purpose of these conversations is to gather constituent feedback regarding Chesterfield's return to learning options so that we can adopt a plan for the fall that best suits our students and their families, as well as our teachers and staff. While none of us could have predicted the impact of the pandemic this past spring, I'm proud of our county's commitment to ensuring that our learning continued, and we were especially impressed with how our central office staff and our high school administrators worked so hard to create a meaningful graduation ceremony to celebrate the class of 2020. Going forward into the fall, we are confident that our outstanding team of educators, administrators, and central office staff will continue that excellence as they plan and provide an engaging learning environment for all of our students, regardless of what comes our way. Hearing from our community helps guide us through those tough decisions that we are facing. No matter what learning looks like in the fall, be assured that we are committed to our students, our families, and our employees. Now it's my pleasure to introduce the Superintendent, Dr. Merv Doherty.
Thank you, Madam Chair, and welcome everyone. Good morning. I am sharing with you a slide presentation. After I conclude the presentation, we will take questions. So let's begin. Our opportunity to share with you our return to school options for the 2020-21 school year. This is as where we are as of today. As you are well aware, today is July 1st, we entered phase 3 by the governor's orders, and who knows where we will be even tomorrow. So our options are many, preparing for the unknown. So let's begin. First of all, in our agenda today, and thank you for your comments, Madam Chair, and our review and acknowledgement, our presentation will show options, acknowledgement of the uncertainty of the future, and then we have a question and comment period opportunity. So we believe in Chesterfield that face-to-face instruction is the best for all students under normal circumstances. We want students to return to school as quickly as possible, but when it is safe to do so for staff and students. And I continue to remind people that safety and health of our students and staff is extremely important, and that we do follow guidelines from a variety of health agencies. And we realize that there are families who want to return to school now, and there are others who prefer that they do not want to. And it is clear that we will not be able to make everyone happy with the decisions that we have to come up with, but we are doing so to the best interest of families and of staff. The school board is expected to vote on the school division's plan for reopening at a special board meeting called for July 20th. So everything we are about to discuss is good as of today's date, as things keep changing for us. We will continue to communicate in our weekly messages to our staffs, our parents, and community. We rely on the Centers of Disease Control and Prevention for information, the governor, the Virginia Department of Health, the Virginia Department of Education, and the Chesterfield County Risk Management Team, who works with the Chesterfield County Health Department. We are reviewing the executive orders, social distancing guidelines, and other health and operational recommendations. And as you know, these health recommendations and other guidelines that we have do change frequently. And we're always waiting for additional information on phases for the future, as entering today in phase 3, and what will happen after phase 3 in the near future. We are all uncertain. So we are making sure that we speak to staff members, students, families, communities, doing surveys. By the time we get to the July 20th, we will have held through school options and district options, and what we're doing here with our Facebook opportunities, almost between 80 and 85 virtual meetings for feedback. We know that the variables are individual family choice of in-person or virtual. The issue of access for all students to have technology and internet, we are working on and pleased where we are headed for all students, all 63,000 of our students, to have access to their technology and to internet. The operational flexibility, the guidelines keep changing for how many students can ride on a bus and what is required to ride the bus. How many students can be in a school or be in a classroom. Those guidelines will continue to change. We do still have the executive order of face coverings, and we know that if most decisions that we make will require us to look at grouping of students that is beneficial for families and their schedules, as well as looking at the student schedules. We know that the VDOE guidelines with the Department of Education that we have to submit plans on the health and safety as well as reopening for instruction, but the final decision to open schools will be the Chesterfield County School Board. We are encouraged by the state to make sure that we communicate with our public health agencies, looking at the health conditions, looking at the data, looking at community concerns, and the constraints that we have due to the guidelines that are placed on us. We also know that the local school boards can deviate from the plans provided in the guidance of VDOE. So we did speak with our risk management people who stay in contact with the health departments, and not only from Chesterfield County, but with the state health agency as well as CDC. They are very comfortable with a reasonable of capacity of 50% per day. We know that the Department of Labor will provide workforce guidelines, and right now the date is July 15th when those guidelines will be released. We know that all staff must certify that they are well to come to work. We do have plans if We know that there's a classroom where a student came down with COVID and what to do immediately to clean, to contact people, and to make sure that we can reopen the building once there has been a deep cleaning. We do know that right now a mask is required for a student to get on the bus, and the nice thing about it is if there's more than one family member on the bus, they can sit together. So while we have options that we will review with the school board last week, and we'll share them with you today, we will err on the side of caution. We will continue to think of health and safety for 62,000 students and for 8,000 employees, taking into consideration the guidelines from the CDC, BDH, and risk management. So here are our options and our priorities. One is the safety of students and employees, the social emotional well-being of students, and if I may say staff as well, serving our most vulnerable students well, having equitable access to resources, have flexibility, and make sure we communicate with everyone. We understand the importance of the recovery of lost learning and also entering new learning during the school year, and that we make sure that our staff members have the needed professional development to start the 2021 school year. Our most vulnerable students, the following groups of students will report every day face-to-face school is in session. All levels of 1, 2, 3, and 4 English language learners, and all level 2 adapted curriculum students with disability. Option 1, which everyone would love to have a normal day of school, 100% of our students attending. Every option we have allows from 1 through 5, gives the parents the option to send their children to school or to remain at home for virtual learning. So option 2 is 50% of our students attending every day. And as you can see, it's a odd even schedule. So the day that your child's in school, they would have their full schedule. The following day, they would be home doing the assigned work from their teachers. And then they would come back the following day for review and information on this. So your child and the family would follow an odd even schedule day. And the goal is to make sure that families are all on the same odd even schedule. Option 3 is a 50% of our students being in school. As you can see, Monday is a cleaning day, a staff professional day, and also individual student check-in for additional help for students, where students would come in on either a Tuesday, Thursday, or Wednesday, Friday, and that work from home would be work assigned by the teachers when they were in school, and then graded and checked as they come back to school the following day. Option 4 is a 50% of our students attending 2 consecutive days. So your child could either be on a Tuesday, Wednesday, or a Thursday, Friday. Again, having classwork, and then when they are at home for the work at home sessions, they would have assigned work from the teachers, which would be collected and graded when they return back to the following time schedule. The option that is modified, that we are thankful to hear from our community members after our board session, is that it's similar to the regular option 4, except it's Monday, Tuesday with a cleaning day and check-in day on Wednesday, and then a Thursday, Friday. So similar to the option, just the changing of the day. Option 5 is when you can only have 25% of the students attend. It's 1 day per week. And as we can see, this option is fading quickly with the guidelines changing on phases. And then option 6 is preparing for virtual learning for all students. If we were to start school or the phases change and we go back to a phase 1 where the schools are closed, we would be prepared to provide virtual learning in the opportunities for all students, taking the information that we've learned from our spring, where all students, no matter if they're in school, face-to-face or virtual learning, we will take attendance, we will require homework, there will be grading, the grades will be posted online, and there will be testing as well. So at this point, we know that we are now in phase 3, and future phases may change capacities, and future phases may change the recommendations. The two options that we see that are most viable would be option 2 or option 4B, which allows us 50% face time with continued instruction for our students, as we are in phase 3 at this time. So at this time, Mr. Bullock, I'm finished, and we would love to take questions from the community.
Thank you, Dr. Doherty. As we mentioned earlier, we can just make sure everybody's muted so that we can hear feedback. As we mentioned earlier, we started accepting questions yesterday, and I see that there's already close to 100 on our social media feeds already, so we're going to get right into the questions. But before we do, I wanted to offer Mrs. Bailey an opportunity to give some reflection or observation based on what she's seen and heard so far over the past couple of weeks as we've started looking at the opening of school.
Thank you, Tim. One observation I'd like to make right from the beginning is for the folks that are out there listening to know that your voice does matter and your input and comments are being taken seriously. I think evidence of that is how we've modified option 4 already. There are, 6 options, so 7 if you count option 4 modified version, and that's a lot to consider. But I've seen some comments that families believe that this is a check the box activity and that we really have already made up our mind, and nothing could be further from the truth. I know for me personally, I'm in listening mode and I'm trying to take in as much information, and the information changes daily. We're getting new guidance, we're getting new information, and as the governor addresses the various phases, things are fluid. It could change very quickly as well. So just know that these town halls are really important. Share them with your neighbors and your friends and have people participate and let their voices be heard, because I know my colleagues on the board and myself are really truly listening and want to do what's best for the families and the students and the staff in Chesterfield. But with that, I would like to hear more from folks this morning.
Thank you, Mrs. Bailey. We'll start off. The first question has been consistent through now all 4 of the town halls that we've held. And we should acknowledge that at the outset of this question that virtual learning will be an option for all students in any of these scenarios that we're considering. The question, Dr. Pope, is what exactly is virtual learning? What does that look like? What should students expect and what should parents expect?
Absolutely. Great question and very understandable. Good morning, everyone. We know that throughout the community and throughout the nation right now, we have quite a few terms floating around to describe the learning experience of our students. We hear things like hybrid and parallel and distant and virtual and online and synchronous and asynchronous learning. And what does it all mean? Well, I think what's most important for our listeners today and in Chesterfield County is to understand in Chesterfield County Public Schools, what terms are we using and what do we mean when we use those terms? If we can all get on that same page, we're already one step ahead of the game. So let's begin with that term virtual. And virtual, when we are receiving parent questions, they are often framed as, can my student remain 100% virtual? So I believe our best interpretation and definition for that as a school system is that if a parent wishes to choose that option because they're just not quite comfortable yet sending a student back into our school building, yes, we will have the option for parents and children to remain 100% quote unquote virtual. But even that will look different with our elementary versus our secondary students. We have a well-established secondary program called CCPS Online that runs from courseware. Students sign up. They never come into a school building, but they do have a CCPS teacher who supports their learning. And that teacher helps them with goal setting, progress monitoring, check-ins. If there's a snag in understanding a particular concept, the teacher will work with the student in that area. And that's at the secondary level, those check-ins and that teacher support that supplement an extensive courseware offering that pretty much covers all of our courses minus a few electives that we offer in our school system. We know that for the parents who choose virtual learning and do not want to send their students into our school building at the elementary level, we cannot expect our youngest students to sit for huge periods of time in front of a screen. We are providing those devices, that's already been mentioned, but there's going to have to be those scheduled check-ins with teachers where everybody gets online together. Morning meeting would be a great example of that. So a parent would have a schedule. Their student would connect through the device to the CCPS teacher and then maybe disconnect to work in some of our fabulous learning apps that are highly engaging, almost game-like. I have personally experienced some of those apps. I tend to go with the kindergarten 1, 2, 3 level. They're very enjoyable, colorful, and fun for students. But those learning apps will give the teacher a way to personalize for each child that's connecting virtually. And it will allow that teacher to progress monitor, because we can actually see when a student's logged in and when they're logged in and active versus they're simply logged in and not doing anything on the computer. We can see where students have troubles with mastery and where they're sailing through content. So that virtual experience will still have teacher support, but we know that our students at the elementary level are going to have a slightly different experience than our secondary virtual learning students. So we will be defining that more for our parents who may be considering that option moving forward. I'm not sure, Mr. Bullock, if you want me to cover as well what it would look like in those options that Dr. Daugherty covered, where students will have a blend.
Yes, please.
See you nodding. So, okay, here we go. The other option that we are looking at in many of those scenarios, other than option 1, where we just all come back to school, is that blended experience where a student may have some face-to-face days with a teacher in a classroom, giving that traditional instruction that we're all very used to and familiar with. And then that would be in combination with that same student group also staying at home several days a week. And on those days when that student group is not with their teacher and they're at home or in another setting, maybe at a relative's house or in a daycare, we will have those learning apps available, and the teacher will assign work in those apps. The teacher may also assign work that's not in those apps. You know, there's nothing wrong with that good old-fashioned, when you're not in my classroom, I need you to write 2 paragraphs on this particular topic, that type of thing. So that would be a blended experience. I want to be very clear, though, when the students are not in front of their teacher, they would not be signed in watching the class or participating in the class virtually with their classmates who happen to be in the school building that day. So that's what we mean by that distance learning experience. So hopefully that clears it up a little bit, but I know we'll have a lot more questions on that topic, and we will certainly keep trying to explain that and think of ways to help visualize those experiences for parents.
Thank you, Dr. Pope. Let's stay on that topic real quick, because Wendy has asked, how does this not put students behind? Can you talk a little bit about what we've learned from spring to fall and what we're doing to prepare not only students, but staff as well?
So absolutely, and I think that question of being behind falls to the question of pacing. So we all need to admit that we lost learning this past spring. And one of the things that we've done to first and foremost catch up on that lost learning is we've looked at all of those standards of learning, those learning strands that were not covered this past spring. And then beyond looking at just what wasn't covered, we've had our curriculum specialists dig deeper and look at which of those learning strands are essential for future learning, not only this coming year, but just foundationally for the rest of the child's learning experience. And math is a great example, right? Foundational skills that must be mastered before other concepts can be piled on top. So we call those strands the power strands, because they're the strands that are going to pop pop back up and that a student will need the knowledge and the skills in to be successful moving forward. Those strands are being embedded into this year's and next year's curriculum because we want to give students multiple opportunities to go back and to capture that lost learning and to have that solidly in place moving forward. The model that we're looking at for this fall, moving forward to the question that you received, how can we stay on pace? We do believe that our students having 4 days of experience with a teacher, or 5 days, depending on which option we would go with, will be able to stay on pace with the curriculum. But we have said very clearly from the offset that we have certain priorities. First, safety. Secondly, the social, emotional, and mental well-being of our staff and students. And then thirdly, as we've stated in board presentations, we are looking at this as a marathon, not a sprint. So we are looking at the next 2 years to really get us back completely on pace by spring 2022 so that the learning missed and the learning that's about to happen this year and will continue into next year will get us back on track in that period of time. And we believe that's very doable with the pacing and the mapping that we're doing.
Thank you. Dr. High, the next question probably comes to you. Christy wants to know, when a plan is decided, is it or can students bounce back and forth between the options if they figure out that in-person is not working or virtual is not best for them?
Thank you for the question. We are looking at setting a schedule at the very beginning of the school year. And with that schedule, an individual will stay on that schedule for the quarter or the 9-week period. And there will be communication between families and schools during that period to determine if that process is working for the student or if there needs to be a shift. But it will be a 9-week period is what discussion is right now.
Thank you. I'm going to bounce back to the beginning and acknowledge something that I probably should have asked at the beginning, and Joelle's just reminded this of us. The American Academy of Pediatrics on Friday issued recommendations that lent towards sending students back to school, that they needed to be there for social, emotional, mental, physical, and other reasons for their well-being. I would acknowledge that this came out on Friday. This presentation was given to the school board last Tuesday. We have since sought additional information and observations from the Virginia Health Department and are waiting to hear from the Virginia Department of Education on this as well, and have sent this over to our risk management team to see how this AAP guidance and recommendation plays into what we've looked at so far. So to those folks like Joelle and others who have asked if this is reflected in our plans, it is not, because the plans as they stand today were developed prior to AAP's recommendations, but we are certainly looking at them and seeking additional information. As Dr. Taylor shared last night, the folks on the screen here who are answering the questions today are well-versed and experts in education, but none of us hold a degree in medicine. So we're going to be deferring to those folks. Dr. Taylor, while we're along those lines, can you talk about the groups that we're relying on for guidance in this regard?
Yeah, thank you, Mr. Bullock. Appreciate that question. We have been reliant on several partners who have helped us to develop this plan. And there's a couple of caveats that I want to throw out there for our constituents that are with us this morning. The first one is that any recommendation that we make to the school board in July is going to be contingent on the phases that we are aware of and the guidance that's tied to those phases. So if the governor's office changes our phase reintroduction into a response to COVID, we may change our recommendations as well, and that those changes will likely occur as we progress closer and closer to the fall. Our guidance has primarily come from a handful of sources. The first being the Center for Disease Control, whose mandate is clearly focused on stopping the spread of COVID-19 and not necessarily considering the things that the American Academy of Pediatrics is focused on. We've also been receiving guidance from the Virginia Department of Health and the governor's office directly, and through that also the Virginia Department of Education. they have produced their R2020 plan for recovery and restart of learning, and that can be found on the Virginia Department of Education's website. And it is providing guidance per phase as to what the safest and optimal return to learning scenarios might look like. It's important to note, and I said this last night and I'll say it again for this group, we would love to tell you that instruction is our number one priority. The reality is that student and staff and campus safety is really our number one priority, and instruction is our number two priority. So all of our plans that we put forward and all of our recommendations are going to track along the lines of following guidance from the CDC and following guidance from the Virginia Department of Health and the Virginia Department of Education as being some of the support agencies that are providing us that guidance. We're really excited by the American Academy of Pediatrics report. We think that provides a lot of valuable information and will hopefully inform some of the future guidance that we receive from those support agencies. But that's where we're taking that information from, and we're working with our county risk management group to take those guidelines and recommendations and then to turn them into tangible practices that we can employ to keep our students and staff safe.
Thank you, Dr. Taylor. The other one that I want to step back and address real quick is we've had 2 questions submitted this morning in Spanish, or 2 comments in Spanish, acknowledging that they're not able to necessarily directly participate. And David wrote on Facebook that the Dale District, as Ms. Bailey knows, has a large Hispanic population as well. So I do want to acknowledge that we're working with the appropriate departments within Chesterfield County Public Schools to host a town hall similar to this for Spanish-speaking families. And all of our families received last night an invitation to apply for small focus groups, both on lessons learned from the spring and also what the big concerns are heading back into the fall. And there will be specific focus groups for Spanish-speaking families there too. So we do appreciate those comments that have been shared. Mr. Davis, Dr. Taylor just talked about who we're relying on from guidance. Maestra wanted to know what the staff process was to certify, so I'll take that one and then prep you for the cleaning aspect of it. All of our staff members across the board have received within the past 2 weeks a checklist that is combined from risk management and the state health department of things that they should be asking themselves and things that they should be doing prior to come to work. That includes taking temperatures, doing self-assessments, making sure that they've not been around anybody who's been exposed to the illness. So we believe that our staff will be taking care of themselves in order to come to work as appropriate. In fact, the second document that our staff got this week was a document that they have to certify that they will go through this self-assessment every day before they come to work. That is now a condition of employment. So we are taking this very seriously with our staff, not just to make sure that we're protecting students, but to make sure that we're protecting staff members as well. Mr. Davis, Mackenzie asked, she stated there should be more than 1 day for cleaning. Can you help clarify exactly what's going to be done every day for cleaning?
Yeah, thank you, Mr. Bullis. A safe and healthy environment is just our top priority. As Dr. Taylor mentioned, safety, health, we just want our students to be in an environment where there is the minimum chance of spreading the disease. And cleaning does take place every day. We do have options where there's going to be a focus on cleaning in the building, and that will allow some even more vigorous cleaning. People use the term deep cleaning. I'm using the term vigorous cleaning because the vigorous cleaning is going to take place every day. But when you think about, let's say if we have the option where Wednesday is the day where there's maybe some small group instruction and a focus on cleaning, that will allow our both in-house and contract custodial staff to really give even extra attention to all the surfaces and areas that need to be clean, and they can do that without students being in the building. So it'll be more thorough on those days, but every day our in-house day porter staff working with their building operations supervisors will be seeking to clean restrooms 4 times a day. We'll be seeking to clean those high-touch surfaces frequently, even playground equipment. I'm heartened now to see that there's a path where we can use playground equipment according to folks like the American Academy for Pediatrics. A couple weeks ago, we were thinking maybe no recess, but if we keep our eyes on that equipment and clean it from time to time, hopefully we'll be able to follow that kind of guidance and give our students those opportunities. But we also have our contract custodians that work every afternoon and evening, thoroughly cleaning the entire building. So we're going to, again, do vigorous cleaning every day, and there'll just be the opportunity on perhaps a day such as Wednesday, if that option is chosen, to do even more thorough cleaning while students are not in the building.
Thank you, Mr. Davis. And just to expand on that a little bit, I think Wednesday was added as an option so that we could actually clean between the two sets of students and do that vigorous cleaning so that we could help eradicate whatever may be there. Jennifer, in following up, Mr. Davis has asked about bus drivers and cleaning buses. What are we going to be doing along those lines for cleaning? And what does transportation look like in the fall?
Well, I could talk about that for a while. So let's do the cleaning piece first. Been working real closely with Dr. Calvin Fry, our transportation director. He has shared a draft of protocols that are going to be shared with our drivers. Our drivers are excited to come back and see our students. And so we meet with them in the first week of August, and we're going to talk to them about how their jobs are going to be somewhat different. There's going to be fewer students on the bus, but they will be cleaning those buses more often. We expect them to have some type of ability to spray down the bus twice a day, probably at the conclusion of their morning runs and at the conclusion of their afternoon runs, using a disinfectant while they themselves are wearing PPE. And this will be a spray disinfectant that will hit every surface and hopefully quote unquote cure and disinfect those surfaces in 5 to 10 minutes. They will also do a little bit of hand wiping themselves on those rails and in areas where everybody puts their hands. So the driver is going to be briefed on doing that. We believe that the buses will be clean. But your second question is, what is transportation going to look like? The initial guidance that we got about maintaining 6-foot social distancing was, kind of startled us, because I looked at a school bus and thought about how, where could the kids sit? And I saw a room for a driver and 9 students. That would be a very ineffective system and frankly, difficult to actually have a chance of transporting all our students that need transportation. Fortunately, in talking to our risk management staff, Dr. Doherty suggested the opportunity to perhaps have a student every seat in a checkerboard pattern. And we've gotten some consensus that that's something that we can do. And not only have a student in every seat, but if we have sibling pairs, to have those siblings sit together. So again, we're not going to have 50 high school students up to 60, 70 elementary students on a bus at a time until restrictions are lifted farther. But we're going to do our best to plan routes for those students that need transportation. Parents are going to have an opportunity very soon to inform us if they need school bus transportation. We've had lots of folks that have written to us and said, hey, we know it's going to be different. We're willing to drive our kids to school if you'll please take them in the building and educate them, asking us to use our transportation resources for the communities that need it the most. So we will hope that parents will indicate to us in the very near future, especially if they do not need transportation, because we typically route every student. But now we have the technology available for parents to indicate to us that they don't need the transportation. And oh, by the way, that's not a commitment for 180 days. If personal circumstances change and a family now needs to use the bus service, they'll have the opportunity to tell us that and for us to route them on a bus. So we expect some staggered schedules. We do expect some buses will have to double back into the community and get a second load. So as opposed to all the students arriving in a 10-minute time frame, whether they're coming by parents or by school bus, we think that window of opportunity for them to arrive may be larger, 20 or 30 minutes. It's just going to be practical. It's the only way it's going to get done. And we're doing an awful lot of planning to make sure that our transportation is safe, clean, and effective.
Thank you, Mr. Davis. No need to respond to this next comment. Jane just wants to make sure that we have enough soap and paper towels in the restrooms. So,
Indeed.
Dr. High, the next one, we talked a little bit about what we're doing to make sure that come to work well. Marcia and Lois are having a conversation on our Facebook page about what we need to do to make sure we're following the sick day guidelines for our students. Can you talk a little bit about what we're going to be doing to make sure that students come to school well, and when they don't or are exhibiting symptoms, what are we going to be doing?
One of the first things that we'll be doing is asking parents to help students do a self-check before they come to school every morning. Once they are here at in our buildings, teachers will be watching, administrative, all staff will be keeping a close eye out on students to see if there are indications of students not feeling well. When a student exhibits where they're not feeling well, whether it's a headache or symptoms that may look like it could be symptoms for COVID, then we would send them to our clinic. We've had discussions that it will be important for us to have a place for kind of the sick side and the well side. For well side, meaning if a student has, fallen and needs some ice, then that would be the well side where they can quickly be taken care of and then go back to class. In terms of our sick side, we would have nurses. We've purchased thermometers and items to ensure that we are able to take temperatures. We will have PPE for our clinic staff who are working with our students. If a student is sick and needs to go home, we will, make calls to families and request that the student be picked up. While we're waiting for parents to come, we will keep them in an area where they are not interacting with other students for the safety and welfare of our staff and students who are in school. So that's what we are right now. Was there a second part to the question, Mr. Bullock?
No, I think I'm gonna tag on to yours. Alicia just wants us to clarify what a self-check is, and so those same questions that we've asked our staff to ask themselves, we'll be sharing those with families as well, and that's just an opportunity for parents before they put their child on the bus or however they may get to school to ask students to check for symptoms and to check for potential exposure. So we'll be sharing that with students as we get closer to the start of the school year as well. Not sure if Dr. High or Dr. Taylor wants to take this one, but Mackenzie's tagged on to where Dr. High was too and said if his child is diagnosed with COVID, will that classroom, school, etc. be required to quarantine so that teachers and staff are protected? And the other question that has tagged on to that is, will we notify individuals if a student comes down with the illness?
Okay.
I'll start off, and Lisa, if you wanna back cleanup, that would be great.
All right.
Should we find ourselves in the event where one of our students or one of our staff members falls ill or becomes symptomatic, the first thing that we can share with families is that we will have a specialized area in the school that is specific just for symptomatic and ill children. Pediatrician offices have figured this out years ago, where they have a well side and a sick side of their waiting areas, and we will do the same and have a specific area in our schools. In terms of notifications, we will not share the names of anybody who becomes ill in protection of their health privacy rights through FERPA and through HIPAA. But we will notify folks if action is required per CDC guidelines, meaning that they were in close contact with somebody who was ill. Should we find ourselves in a situation where somebody has been ill in a classroom space, that will trigger some significant cleaning protocols for that space. And that about sums up where we are at this point. And Dr. High, do you have anything else you want to share?
I think you covered it. Thanks.
Thank you both. Dr. High, this one probably will come to you. First, Lauren and Chris have noted that alternate day schedules seem like a logistical nightmare for childcare purposes for families. And then Lisa has asked, will parents have an option on which days they get to send their children if we go Monday, Tuesday, Thursday, Friday, that type of thing? What type of process are we looking at to make this easier for families?
Okay, you are exactly right. When we're going through these scenarios, we're seeing that it could be a logistical nightmare for not only staff and families, but for administrators as well. So, in looking at how we would schedule it, in the options you saw that there are 2 days in a row or every other day, which would allow families to know which days of the week the students would come. There was an option, I believe it was option 2, where it is Monday, Tuesday, Wednesday 1 week, and then Thursday, Friday the following week. That would be a little bit more of a logistical nightmare, but we would work through that if that is the option that the school board takes forward. In terms of how we will be deciding or working to have students come, it will be based on, right now we're talking about using the alphabet. So if you're A through K or whatever, however it falls with that 50%, that's how you would come to school. But we are taking in consideration that, there are some families who may have different last names in the household. And so we will ensure that families will be able to come to school together if there are groups of students who are coming, from the same household. In terms of being able to choose when you come, that's going to be a little bit more difficult because we have to be able to do it in a way that transportation will know, staff will know, and that it will remain consistent throughout the process.
Thank you, Dr. Hyatt. Dr. Pope, in just a minute, I'm coming to you with questions about special education, so I just want you to be prepared. Dr. Taylor, the next one is for you, and it's aligned with staff as we sent these meeting invitations out to our staff members, 8,000 staff members as well. Rachel asks, if a staff member contracts COVID as a result of being compliant in teaching during this, will their time away be docked as sick time? Can you talk about the leave processes that are in place?
Sure, I'm gonna answer this very concisely, and that's gonna say that our benefits office would love to have a conversation with you. The federal legislation that was recently passed to provide additional protections for our staff related to COVID has opened up a number of opportunities for staff to take different types of leave that would protect them in this situation, different than taking normal sick leave or other times. So what we would ask is that staff members that have a specific question about their leave, or if they find themselves in a specific situation tied to COVID, that they reach out to our benefits office by emailing benefits@ccpsnet.net or calling our benefits main line. We really would love to hear from you, and we want to make sure that you are adequately protected and that your leave time is also protected. And the best way that we can do that is to address your individual circumstances as you have them.
Thank you, Dr. Taylor. We're about halfway through, so I just want to welcome those who weren't with us at the time we started and just quickly recap. As of the first 45 minutes, we've looked at the various options that we are considering. We've acknowledged that there are two that are more viable than the others. That would be option 2 and option 4B. And during the last 45 minutes, we've heard from a lot of parents with a lot of different questions related to health, operations, and instruction. And so we're going to go into the special education world right now. And Dr. Pope, the questions, I'll put 3 of them all together in a package for you. What types of special education services can we expect during the fall? How will IEPs be implemented? And then Wendy wants to know about ESY for summertime, potentially.
Okay, I'm going to try to remember that package deal you just served up to me, Mr. Bullis. I think I'll start in reverse order and begin with ESY, Extended School Year. And we do know that IEP teams work together to determine each student's needs, and if a student needs that extended school year opportunity. We are 100% virtual still in Chesterfield County during the month of July with our educational programs that we're delivering. The parents of our students who do need extended school year services have been contacted, and many of them have chosen to continue those services in a virtual way. We are excited, of course, for all of our students to come back and be face-to-face with us for instruction. And I think that gets to the other 2 questions that you just asked. And we went through some options at the beginning of this presentation with Dr. Daugherty. And we know that those options are designed generally for our entire school system. But wherever our school board lands in July on the option that will move us forward, we understand that it's important that we work with that option and we stretch it. We stretch it in every way that we can to make it fit the needs of each of our students to the best of our ability, given the restrictions we may face. We have to stretch some of those options for some of our special programs like CTE, dual enrollment, our gifted programs, but we also have to stretch those options for our students that we call our more vulnerable learners. And we know that from Dr. Darty's presentation earlier, I think it was on slide 15, he mentioned that the students that we have high concern with, that we really believe must return to our buildings for every day of face-to-face instruction, that we are open as a school district. We have our English language learner group, and we have our students with disability, especially level 2 service students who need that more customized, collaborative, often special education program delivery. We know we have special programs like ADP and IDP, for example, where we already have much lower class sizes. So we do believe we have that flexibility to bring those students in more frequently and give them that face-to-face instruction to help them close those learning gaps. As far as IEPs, and how do we handle IEPs? Very much like we had to do this spring. We look at each student's accommodations and modifications. We look at what is possible in a face-to-face classroom learning environment versus what is possible as an accommodation or a modification in a virtual learning setting. So we make the adjustments, and again, given the restrictions we face, we try to deliver those services to the greatest extent possible. And that is why IEP teams have to often convene to look at what those restrictions and those possibilities are. One of the questions we actually face with our students who have IEPs as we look at potentially coming back into the building, we will have to make a student-by-student determination. When I say we, I mean the IEP team that has that child's best interest in mind and that knows the specifics of each individual child. The first question they will have to ask is, as the student comes back into our building, will the maintaining of social distancing or whatever the requirements may be, whether it's wearing a mask or not, etc., will the student be able to adhere to those expectations? That is a question that has to be answered. And then from that question, we move forward with the very best way to deliver that education and those services. It is always a work in progress, and it always is a customized, personalized approach for each student. But to, I think, the spirit behind all of the questions, I just want to say that our entire special education department is doing everything possible to work with families and to figure out creatively how we can address learning loss and get our students all back with us in either a virtual, distant, or face-to-face model.
Thank you, Dr. Pope. Dr. High, I'm going to ask you to help me with some clarification here. I want to make sure we're friends on YouTube as well. Philip writes that he's concerned the decision is being made less than a week before school starts for those of us with children in year-round schools. There will be very little time to make preparations. Can you explain what we've done with the year-round calendar for this coming year?
Yeah, so in June, we went to the school board and made the recommendation to not have year-round school for this upcoming year. So students who are attending year-round school would follow the traditional schedule. So they would start on September 8th with all of our students at the same time. And we will revisit at the end of the school year and actually have already approved the calendar for year-round for the 21-22 school year. To go
Thank
back.
you, Dr. Hahn. Thank you. And just to clarify for folks who might not be familiar with where we have year-round schools, in the Dale District, that would exist at Fallen Creek Elementary, and then in the Bermuda District at Bellwood Elementary. And so with the school board scheduled to take a vote on July 20th, we're actually providing almost 6 weeks of advance notice as much as we can to prepare for families for these changes that might be coming. Again, we'll throw out the caveat that any time after July 20th, if we advance in a phase where we become less restrictive or we bounce back into phase 2 or even worse, phase 1, then we'll have to go back and make adjustments as we move along. Dr. Pope, actually, let's go to Dr. High on this one. Melody via YouTube is worried that there are home situations where both parents are working, and how are we going to work with child cares to make sure that they know what we need in terms of assistance for the virtual learning piece?
Okay. And so some of our staff members have identified a lot of the daycares that we currently have students attending. And so we're reaching out to, one, let them know that we want to partner with them in this process. We will provide them some of the same information that we provide to parents. We have talked about a video for parents to explain what virtual learning or that hybrid learning will look like. So we will share that information with the daycares. We also will provide access and training on some of our programs, use of Canvas, Edgenuity for our secondary, and some of the Alexia, Mayan, some of those programs for our elementary students. So we are working as much as we can, as closely as we can, to work with the daycares to support families, because we know it is difficult when you are, working, two parents are working, and the students are in daycare every day. So we will partner, and of course there will always be that teacher who will be able to talk back and forth with you as well as a family.
Okay. Dr. High, I'm going to stay with you on this one since you work closely with schools on staffing, and I think staffing may play a little bit of a role in this answer. Carrie wants to know, why do we need to make a choice? Why can't we offer options so that people can choose any of these 6?
For planning purposes, we are limited in the number of staff members that we have to support our students. And so we, at some point, need to determine, families have the option to make the choice whether to send their students back in the model that is proposed, or the option that's decided, or to keep their students home virtually. And if you choose to keep your student home, virtual will look different than the face-to-face model that will be present. Still, if you are having your student be virtual learning, they will still have interaction with a teacher. There will be some synchronous learning, but there will probably also be some asynchronous learning, which means asynchronous, the teacher has provided an assignment, the student is working on their own, and then the teacher is checking back in with the student and providing feedback throughout the process. And so that's what we really need to know, so that we can plan for how we will utilize our staff and make sure that everything's covered, so that we can continue to give high quality education to all of our students.
Great. Thank you, Dr. High. Mr. Davis, want to bring you back into the conversation. We always like to look forward and plan forward, but a parent Terry Ann has asked, in light of the past problems with Legionella bacteria in heating and cooling systems, what is the school division doing to ensure heating and cooling systems are properly functioning and air circulation is optimal?
I think that's a great question, because the history here in Chesterfield isn't the greatest. Maintenance of our HVAC systems and units were deferred in many buildings until recently. Obviously, the Legionella bacteria showed up in a recent summer. We have been very, very aggressive with the cleaning of our cooling towers, and we are now running what are called dual biocides. In other words, agents that kill those bacteria. And we've got inspections underway this summer. So if even a tiny amount of Legionella shows up in a cooling tower, we know exactly what to do with it now and cut it off at the pass. And the other message that I've got, though, is that some of our schools are now enjoying modernized HVAC systems, and we expect those replacements to continue in the future. But that's not an overnight project. We're not going to all of a sudden modernize 65 HVAC systems. So much more relevant is now our preventive maintenance program. We have 4 very reputable contractors that are working closely with us, and they have inspected and made some repairs at all of our schools in the last 2 years. We've gotten some more guidance from governing officials, you might say, in the HVAC industry. It's called ASHRAE, and they have suggested things in the COVID environment, such as upgrading our filters, seeking to have more ventilation, running these systems a little bit more. So maybe our energy conservation will dwindle a bit in lieu of running these systems more vigorously and ensuring that we have good ventilation and HVAC systems in our schools. And we're going to do that, and we're going to continue with the preventive maintenance, which is, again, relevant to every one of our schools right now. Those programs are underway. We're going to inspect those systems with those contractors and our in-house staff. We want comfortable conditions for our students, but most of all, we want safe and healthy conditions. So some hard lessons were learned here in Chesterfield in recent years, but we're on the road to more than recovery, but safe buildings for each of our students. So thanks for the question, and I hope that that's been adequate.
Mr. Davis, you can keep your mic on because I'm going to come right back to you. Maria wants to know if we can add hand washing stations and or scheduled periods for hand washing in the schools. Can you talk a little bit about what we're doing with hand sanitizer and such?
Yeah, that's good. Hands are washed, of course, in sinks and restrooms. Many of our elementary students have some sinks in their classrooms, especially for the younger students. But one of the concepts that's underway, they haven't been installed yet because they haven't arrived, is to add hand sanitizer dispensers at high traffic areas in our schools. So our facility staff has ordered that equipment. We're going to be installing it here in the next couple of weeks. Hopefully when it comes in, it'll certainly be in place well before September. But opportunities when kids are going to the cafeteria, leaving the cafeteria near restrooms to get a little squirt of hand sanitizer. And we might go through a whole lot of it. I attended an analysis or a presentation the other day that suggested if every student hits the hand sanitizer station 4 times a day over a period of a year, they'll use a gallon. So a gallon times 63,000 students plus 8,000 or 9,000 employees, that's many truckloads of hand sanitizer. So we're in position to start ordering the stuff and to have it on hand. We know employees carry it, students carry it too, but the time will be made, and I know that'll be occurring at the individual building level to determine the best time to have that reinforcing shot of whether it's hand sanitizer or hand washing. But it's so important and noted by CDC and all of the government and the health agencies that we're working with to provide the ability to keep hands clean, and we're going to do that at our schools.
Thank you. Dr. Howard, Mr. Davis just opened the door with the word cafeteria, and some folks are wondering how lunches might be handled. So since your team works with schools and helping develop school schedules, what are we looking at for cafeterias?
So there's been some discussion, but to be honest, there hasn't no final decision of how we will do this, but we know that large areas, we have to be careful with the social distancing in the large areas. So there's been several discussions. One, having students go through the line, practicing social distancing and having the food taken back to the classroom. But in order to go through the line, that ensures a hot meal. So having elementary students go back and having lunch in their classrooms. At the middle and high school level, we've talked about, again, students coming in, getting their lunch and finding spaces or back in their classrooms as well, having lunch. But we've not really finalized that decision or gotten really far down the road on where we are with that. But definitely social distancing and following the guidelines that are present from risk management as well as CDC and all of those.
So truly a case where we don't have all of the answers at this time.
We do.
I think we've got several months left to still figure it out. Dr. Taylor, the questions come in. How are we going to keep them with the cafeteria discussion? If we don't bring students in every day, how are the students who need meals potentially going to get them?
Yes, thank you, Mr. Bullis. It is our intention to continue meal service. It may look a little bit different than how we have done it this past summer and this past spring. We are looking at several options. One option may look like providing kiosks at the front of schools for students to take additional meals home when they do come to the schoolhouse, and potentially having kiosk service in a separate area of the building or outside of the schoolhouse, outside of students having to come into the building to receive meal service. Right now, we're still discussing how best to do that and how best to maintain service for the students who need it most. But it is our desire and our intention to continue that meal service into the fall and beyond.
Okay. Dr. Taylor, if you keep your mic on. Next two questions are somewhat related. Nancy wants to know, will staff members be given regular COVID testing? And the tag along to that is, are we going to require students to be vaccinated for this when a vaccination is developed?
So we do not technically require a vaccination, and we don't practically require a vaccination either. That would be something that state law would have to put into place before we made a requirement or a policy recommendation for the board to consider. It would be something that would be written into our policies and practices at the board level. Right now, we're not planning on making that a requirement. And not planning on making that even a recommendation at this time. We would encourage, obviously, when a safe vaccine is produced, that as many folks take advantage of that opportunity as possible, but not a requirement. And the first part of your question, Mr. Bullis, was?
If we're going to be providing regular COVID testing for staff.
As a matter of fact, we do have COVID testing available through our employee health center. But it is not something that we provide directly. It is something that they would have to go through their insurance company and through our employee health center to receive.
Thank you. Next several questions start getting into the nitty-gritty about daily operations within schools, not from an operational standpoint, but from an academic standpoint, really. Dr. Beth has asked if we have considered using high schools as extra space. High schoolers can do distance learning better than younger children. I think we have looked at that, and there may have been some concerns about staffing levels and not the availability of classrooms, but whether or not the classrooms were correct in terms of usage for some of our younger students. Can you expand on that?
Yes, we did consider that, had conversations with principals, and our concern really is, one, staffing. If we are spreading our staffing out, spreading students out to schools beyond our elementary schools, that there would not be enough staff to cover that. And with, our teachers, there are licensure issues and endorsements that a teacher must hold in order to teach a certain group of kids. So we, right now we are expected to follow the Virginia Department of Education's licensure. So that would create some concern for us. And then the second was the way that middle schools and high schools are set up. They are not conducive to our youngest learners and teaching them in that way. And then in terms of materials, making sure that we have the right materials at a high school would be a large lift that I'm not sure that we would be able to do if we moved kids there.
Thank you, Dr. High. The next couple of questions deal with the time that we're in, which is an anxious time for many and an uncertain time for many. And during that time, we'll acknowledge that a lot of rumors get started and people start to hypothesize and speculate as to what school might look like. There are a couple of rumors out there that we'd like to address now, and folks have actually asked about them this morning. The first one at the high school level is a change to a 4x4 block, 4x4 schedule. Can somebody identify what a 4x4 schedule is now and how it's different from what we currently use? And then is that something we're moving to next year?
Thanks, Mr. Bullis. I'll take that one. Though we never want to dismiss any idea, we are not considering a 4x4 at this time. We are best positioned to provide a schedule that is as close to what students would expect in planning for the regular school year, and putting us in a position where we can pivot easily between a virtual learning experience as well as a face-to-face learning experience. For those of you who are wondering what a 4x4 schedule is, it is essentially students taking 4 block classes on a semester basis and not on an odd, even day schedule. Our students at the high school level are used to having a majority of their classes on an odd, even day schedule. And us getting as close to that type of schedule as possible would be optimal. And that's the approach that we're looking at this time.
Thank you, Dr. Taylor. This one's up for grabs as well. Rumors out there, according to several posts, that we're going to eliminate electives. This is our opportunity to get rid of the fine arts. We're not going to do resource classes at the elementary level. Who wants to tackle that one?
I think that this couples nicely with the 4x4 rumor, because what we intend to do is honor the requests that students have made in their course request process this winter and this spring. And we want to get kids as close to the courses that they intended to take this school year. We have obligations and requirements to keep kids on track for graduation, And even at the elementary and at the middle school level, we want to maintain a lot of aspects of the school experience and try to keep them intact as much as humanly possible. And that involves our elective curriculum as well as our core curriculum.
Thank you, Dr. Taylor. Dr. High, Dr. Pope, individualized, specialized opportunities such as tech center classes, John Tyler dual enrollment. How will those operate in the fall?
I'll go ahead and take that one. So as in public education, we know that our community colleges, and we partner with no less than 3 community colleges, they are all working through the same process that we are right now, considering what's possible and what their models might be. So to be able to answer partnerships with dual enrollment, that one needs to wait just a little longer. I know it's hard to be patient. We all want the answers right now, but the conversations are ongoing, and we are going back and forth with what our options that we are being very transparent with the public are, and how those options, wherever our board lands in July, could work with each of our community colleges and what they are considering. So that one we have to wait just a little bit longer on. As far as our technical centers, we love our technical programs here in Chesterfield County Public Schools, and quite a bit of our conversation is in each of those options. How do we stretch them so that they can work to deliver the technical programs that we have offered and that our students have signed up for? It is our full intention to offer those programs, and we understand completely that it is very hard to go through a technical program and not be in a classroom lab setting, being able to get hands-on experience. So in all of our models and in all of our scenarios, we are considering how can we make that happen for our tech center students. Luckily for us, because of regulations, so many of our tech classes are very small in size because of that lab experience, that it does make it more doable. But there are, of course, still details to be worked out. I do want to assure our families so that we are moving forward and highly confident that students will be able to have hands-on experience and that they will be able to go for those credentials, those certifications, and those other acknowledgments of mastery in those trade fields.
Thank you. Mr. Davis, coming back to you on this one. We've got some folks who are chiming back in about transportation. One parent says on YouTube, if you make it easier for us to bring our children and pick them up, then more parents will do that. And another parent agrees, saying, I'm sure many of us would work together to take our kids to form a carpool. Can you talk about what we will do to work with the police department to make sure they're aware of any changes in that regard?
Yes, thank you, Mr. Bullis. I did talk mainly about buses the last time, and in mentioning the opportunity for parents, whether it's in carpools or individually, to come to schools. Let's chat about how that would work a little bit more. Those areas can be congested. Some of our schools are on busy roads, and so we are going to enlist the assistance of our public safety officials to help us at some of those areas of congestion. I did mention the possible staggering. Other strategies include having multiple staff members out at the curb to greet students or to deliver them in the afternoon so that multiple cars can be loaded or unloaded at the same time to move that traffic along. We are also going to probably have that drop-off line maybe snake through the parking lots in some circumstances, as opposed to coming directly from the road to the drop-off point. We want to get those cars off the road. So again, it's going to vary from school to school. We're taking a look at each of them and going to work with our public safety officials to help us, especially in those first few days until we establish a rhythm. Both bus and parent drop-off transportation, it takes a little while to get down a routine, and we want safety, and we want, and I know we're going to need the assistance of the police in some of our areas. So thanks so much to the parents that are ready to talk to us about those options, and you're going to be hearing from us soon so that you can formalize that information to us. Thanks again.
Thank you, Mr. Davis. Dr. High, we have a parent who's written specifically about option 1, but it really pertains to any of the options we choose. They want to know, this is one of our friends on YouTube, they want to know how would things like chorus, clubs, and other extracurricular activities be impacted in any of these options? I'll let you go with that one, and then Dr. Taylor, if you can be ready to follow up with where's the Virginia High School League right now with sports?
As Dr. Taylor stated earlier, our goal is to allow as many courses that our students have signed up for to move forward. So we would be proceeding with, courses like that, with the social distancing and the guidelines. We're going to move forward as much as possible based on the information that we have. So the plan is to continue to have those VPA courses available to our students.
Can I get you to expand on that one real quickly? And like French club and clubs that typically meet after or before school, how would we look at handling those?
I think we would still be looking at our teacher sponsors, working with our high school principals to ensure that we can have clubs as much as we possibly can. But it depends on the guidelines that are out there for us. If we're able to have some after school sessions, then we would try to make that experience for students as rich as possible.
Thank you.
And to chime in on the Virginia High School League, for those of you who are unaware as to what the Virginia High School League is, it is the independent league that governs our interscholastic competition. This covers everything from debate and forensics and even theater, one-act play competitions to what we do on the field and on the court, whether that's tennis, basketball, football, or field hockey and soccer. And the Virginia High School League has submitted a plan to the Virginia Department of Health for approval to get students back onto the field for conditioning for the fall season. I think we can all take it as a very positive and heartening step forward for students who want to engage in interscholastic competition, that they are making plans to move forward with a fall competitive season. And they have set some tentative dates for the middle of July to begin conditioning pending the approval of their plan through the Department of Health. So where we are right now in Chesterfield is that we will follow the guidelines as outlined by the Virginia High School League, and they are awaiting approval from the Virginia Department of Health to get a green light on on-field conditioning. And what that will look like for the fall season is that on-field conditioning could begin as early as the middle of July. And as we progress through potential phases and as we move forward closer to the start of the school year, that may change their guidance, and interscholastic competition may occur.
Thank you, Dr. Taylor. We've got a little less than 15 minutes left. I think we've got 2 or 3 more questions. I want to let Ms. Bailey see if there's any questions that she's heard from constituents that we haven't asked today. So I'm going to ask Dr. Pope one question and Dr. Doherty one question, and I'll prep them right now. Dr. Doherty, your question, which is coming after Dr. Pope's, will be about expectations with regard to not grading, not taking attendance during the spring. What will that look like during the fall? Let me get to Dr. Pope first, who, under all the plans, Heidi's asked this question, under all of the plans, the ELL students and some IEP students will attend every day. How will this work if the rest of the class is attending 50% of the time? How are we gonna merge that?
Well, that's a great question, and that's a great example as well, Heidi, of all the details that still have to be worked out. I wish I could tell you that we have the answer to every option and every scenario under every option, but quite honestly, that wouldn't be that wouldn't be true. So it's exactly those types of details, so that we have a board where we keep a long list of all of those issues that we still need to resolve, and we're assigning team members to think through them, to creatively bring options forward. So that's going to have to be one that we stay tuned on.
Dr. Pope, that was a perfect answer. Went exactly where I was hoping you would go, and that's that we're somewhat in a read and react phase still, even 3 months into this. The guidance seems to change daily or weekly, and so we're continuing to be flexible. And even though the board is scheduled to vote on July 20th, we're going to continue to monitor this through the beginning of September and make adjustments as we can. Dr. Doherty, before we bring Ms. Bailey back in to make sure that we've gotten all the questions that she's been hearing addressed today, can you talk about the expectations for students when they return in the fall in terms of attendance, grading, work, that type of thing?
Yes, thank you, Mr. Bullock. We learned a great deal from our spring semester. the time that we were forced to close schools. And our expectations are going to be the same for face-to-face and virtual, that we expect attendance to be taken. We expect homework to be given. We expect grading to occur. The grades will go online to the parent site, that you'll be able to see the progress of the student. So we want to make the in-school or virtual learning experience as close as possible together and in sync that we can. And so we are expecting attendance to be taken. We are expecting grades to be given. And we're expecting not only recovery learning to occur, but new learning to occur as we go through each and every day.
Thank you, Dr. Doherty. Ms. Bailey, we spent almost 80 minutes so far listening to questions and comments and answers to those from residents in the Dale District. Have you heard any that we've not addressed that you'd like our folks to address right now?
No, but I do have a couple of comments, and that is that I would like the Dale District residents to know that I've been following along on Facebook and reading all the comments as they've come in, and then I'll review them all later as well. And I really do appreciate your input, but mostly I think I would appreciate patience and grace. This is a time, as we think we've all noted, it's lots of moving parts, lots of decisions that can't be finalized, and yet I can hear the angst in parents' desire to know. And I know that you want to know details. You want to know the details right down to what's lunch going to look like, and what's my child's schedule. And I hope we've answered a lot of your questions today. But I do have to shout out to Jeffrey, who said that we should consult Chick-fil-A to design our drop-off zones, because they have mastered the drop-off zone. So that comment gave me my morning giggle. And I think that that's the kind of spirit that we need, just to recognize this is not going to be easy. I don't think anyone has it easy here, not our parents who struggled with virtual learning and trying to work from home, not our students who desperately miss their friends and their teachers, and certainly not our teachers either, who have pivoted so quickly to try to adjust. And I mentioned yesterday that teachers did not go into education to sit behind a computer. They want to be interactive with their students. They want to be face-to-face with them. And the quicker we can safely get back to that, I think the better. But if we're looking for something or someone to blame, it's the virus. And we need to make sure that we're remembering the reason why we're even in this place. And it's because of COVID-19. So this isn't anything any of us chose. And we're all struggling. But with that, I'll just close this out with my closing remarks. Mr. Bullock? Okay. So first of all, staff, Herculean lift to schedule 9 town hall meetings in a very, very short period of time. So thank you so much for this. I think it's extremely important. Thank the general public for participating and attending today. I hope you felt like you got a lot of answers to questions. I understand that you probably did not hear all the details that you wanted to hear, but I think you know why. But it's really good for us to hear community feedback and receive your input. It's always valuable. I always say you can never over communicate. I understand that the situation is not good, but and that you're struggling, as we all are. But I want you to know that collectively, the school board, my colleagues, have 15 children in Chesterfield County Public Schools. So my colleagues on the board are right there with you. They understand the potential difficulties that some parents will be facing. My board colleagues and I also are struggling with these decisions and trying to do what's best for our parents. As a board, we do, though, have to step back and look at what's best for all of our students, our staff, and our parents. We want to go back to normal, but we must take steps today to ensure normal happens sooner rather than later. I wish there was a clear and easy answer to the situation, We've examined all of the information. We're giving, given lots of information to digest, and we're going to be weighing the best options for our children to safely return to school. We'll make adjustments as needed that will mitigate the gaps and provide an equitable education as we work together to navigate this pandemic. Please share with your friends and your neighbors that we have 5 more town hall meetings regarding the return to learning over the next this afternoon, this evening, and into tomorrow. And we want to hear from everyone. You should also see another survey in a few weeks as we fine tune and return to learning in the fall. So once again, thank you for your participation, and have a great day.
Thank you, Mrs. Bailey. Your comments about grace and patience are very timely in this world that we live in today, as well as your comments about teachers and parents. Our teachers didn't sign up to teach children from home, and our parents didn't sign up to be part-time teachers. So this is a difficult time for everybody. Just one additional point to what you said about the town halls that are coming up. For those who joined us late this morning, these town halls are being saved on the various platforms that we've promoted them on. You can go onto our website and watch all of them as they have occurred, or watch them live in time, and the same thing with YouTube and with Facebook as well. From this meeting alone, we're up to about 825 comments, so we've got some homework to do to continue to look and read. I would mention that all of the comments that have been shared are being provided to our school board for consideration as they make perhaps one of the most difficult decisions that they'll make in their 4 years, at least 4 years on the school board. So with that said, we appreciate everybody taking time out this morning to join us. If you hopped on late, make sure to take a chance to take the opportunity to look at everything that we've gone through for the past 90 minutes or so, or join us at 12 o'clock today for our next one. Thank you for your support of Chesterfield County Public Schools. Have a great morning.